Welcome to the second episode of our podcast. We were intrigued as to which factors determined if a person would develop PTSD or not, which is why we conducted some research and found that items such as age, sex, and marital status had a big influence on it. For one, according to an article written by Thomas Grieger, veterans who were under 25 years old were more prone to have PTSD, and that married soldiers were 3.1 times more likely to meet the PTSD criteria. Moreover, it was proven that the level of combat exposure the soldiers had to endure indicated how likely they were to contract PTSD. Thus, the conclusion that those with higher exposure were 4.8 times more likely to have this disorder than those with lower exposure was drawn. Lastly, the graveness and depth of any acquired physical injury was also an important indicator.
Not only this, but there was also another experiment done by Robert Rosenheck that assessed the ubiquity of most traumatic disorders in white, black, and Hispanic veterans. A total of 12,447 veterans were examined, where 71.2% of these were white, 23.4% of these were black, and 5.3% of these were Hispanic. After they were analyzed, it was concluded that Hispanics showed to have higher rates of psychiatric disorders than white veterans, and a higher number of suicide attempts compared to both white and black veterans.
Moreover, black veterans were less likely to receive the compensation that is granted to veterans by the United States Department of Veteran Affairs, had significantly more issues with psychoactive substances, and were diagnosed with more psychiatric impairments compared to Hispanic and white veterans. However, black veterans showed less PTSD symptoms than the other patients tested.
As further confirmation to all of the external factors that add to this disorder, we analyzed a study conducted by the Association for Psychological Science in which PTSD symptoms were overlooked in 746 Danish soldiers. They were assessed before, during, and after deployment in Afghanistan. It was identified that pre-deployment emotional problems include mostly childhood issues, and that those who presented them were the ones who suffered the most during and after deployment. This study also insisted, highlighted, and raised awareness of the individualism of each case, meaning that there is not one specific way in which the illness will be experienced.
Lastly, we want to thank you for listening and joining us on this session, where you had the chance to learn more about this disorder, which severely affects soldiers and veterans.